Hi guys, welcome back to my channel. I hope you guys are doing well. Today's video is going to be slightly different. I don't think I have done anything like this on my channel. As you guys know, meme reviews are super popular right now on YouTube. So for today's video, I thought it'll be really fun to do a reaction video to some of the popular medical memes out there on the internet. Hopefully you will find this very entertaining as well. Christina is definitely the boss. This is literally me after a 13-hour shift. You have to squeeze your whole life in the 4 hours you have got left. I must admit, I have never eaten in the shower, but I have definitely eaten on the way home from work. So when I reach home, all I have to do is have a warm shower and go straight to bed. I seriously don't know how people with kids do it. When they go home, they have to make dinner, help their kids with the homework, do the bedtime routine. I have so much respect for doctors with kids. Honestly, they must have some kind of superpower. This is so funny, but maybe God helped you to do the surgery. What is more common is patients thanking the wrong doctor or team. Because of how things work in the NHS, patients get admitted under an on-call consultant, and sometimes the consultant does not even see the patient. But when you do the discharge summary, the admitting consultant's name is still on there, so the patient sends the thank you card to a totally different consultant. The things we do as doctors. If you only knew the places these hands have been, I am sure all my medical colleagues can definitely relate to this one. The next few memes is about my favorite subject. Yes, the D-dimer. If you have worked in ED or acute medicine, you know that there is a D-dimer situation. Yes, let's call it a situation. The D-dimer is one of those diagnostic values that can be your best friend or your worst enemy. Some doctors love it, and some doctors are not a fan. And sometimes it is a reason to keep patients in hospital. This is literally me when my consultant asks why I didn't discharge the patient. I love my radiology colleagues, and one of the biggest no-no is requesting a CTPA prior to a chest x-ray. There are so many things that you can see and diagnose from a simple plain film, so I definitely agree with this one. What I don't understand is when you request a CTPA, you must submit a well score and a D-dimer result, or else they won't accept your request. A patient with a right heart strain, a raised PASP, and they still ask for a D-dimer. Why? When I was in medical school, my tutor told me that the most important skill you have as a doctor is the ability to listen. Sometimes as doctors, we tend to ask close questions because we want to speed things up and get to the diagnosis as soon as possible. And let's face it, medical clerking in most NHS trusts has somewhat become a checklist or a worksheet. But it is so important to let your patients speak, because in their 15-minute spiel of their life story, you can always find the real reason for their admission, which will then lead you to the most accurate diagnosis. You can do all the fancy tests and investigations, but at the end of the day, your clinical diagnosis is only going to be as good as your history taking. No one wants a hospital-acquired injury, and falls are the #1 culprit. Almost all patients on Jerry's are on eyesight, so there is always someone watching them so that they don't get out of bed unassisted. There are even fancy devices now on beds that senses and beeps when the patient gets out of bed. Hospital falls are definitely avoidable and should be a never event. This reminds me of my days in GP land. Whenever you're dealing with a mother of a sick child, you basically can't win. That is probably why I never went into peds. This is definitely true after they've introduced the junior doctor's contract. Even to this day, I don't fully understand my rostered hours and how it relates to my pay banding. It is all so complicated. I hope someone is checking on it. All I do is show up to work and do my job. The BMA and the line managers can look into the rest. So I thought I'll end on this happy note. That is all for my video today. I hope you guys enjoyed it. Please let me know some of your favorite medical memes. Thank you so much for watching this video. Please subscribe to my channel for more videos. I do post a new video every week and it will mean so much to me if you subscribed and joined my channel. Until next time, bye!